Hello everyone. I'm often asked, what's the difference between a saline and a silicone implant? And why would I use saline in one patient and silicone in another? Who are the best candidates for silicone versus saline? The first thing I'll say is that despite what you might have read, there really is no visible difference between a saline and a silicone implant. It's very, very hard for anyone to see a difference in the implants. But there is a difference in the feel of the implants. A saline implant feels a little firmer than a silicone implant, and some might perceive that as unnatural. Silicone implants have been around longer than saline implants, first used in the 1960s, and saline came along sometime after that. The ideal candidate for a silicone implant is any woman with a relatively small breast who is relatively thin, whereby the implant is more palpable in that person than in someone who's got more breast tissue and isn't quite as thin. Then the difference becomes a little less noticeable. A saline implant is filled with salt water. It has a silicone shell. The implant itself sometimes can be felt along the edges in a relatively thin woman, and therefore sometimes this is perceived as rippling of the implant. While a silicone implant, which is this implant, can also have palpable edges and or rippling, it's much less common than with a saline implant. And as you can see, a silicone implant is much softer than a saline implant. It's much more compressible than a saline implant. So most women, probably 80%, will choose a silicone implant for the superior feel. And occasionally, though, we will have a patient who prefers the saline implant for concerns regarding the relative safety of the two. I will say that they're both very, very safe implants, both saline and silicone, and this has been studied for many years quite extensively, and the complication rates are very low with each. The one issue that is quite different between saline implants and silicone implants is detectability should a rupture occur. A saline implant, when it ruptures, is quite obvious. A patient calls and says, for lack of a better way of phrasing it, I have a flat tire, because it does deflate completely, sometimes very quickly, sometimes over several days to a week. A silicone implant, on the other hand, requires diagnostic studies, imaging tests, either a high-resolution ultrasound or an MRI. With the MRI being slightly more specific and used more commonly to detect ruptures. I invite my patients back once a year following breast augmentation so that I can examine their breasts, examine their implants, and on occasion I can detect a rupture, but not commonly. Typically, it is difficult to detect a rupture with these new cohesive gel implants as compared to the original silicone gel implants from many years ago.